Welcome to another episode of the Aligned and Elevated podcast. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Community, and your host of the Aligned and Elevated podcast. I am so excited today because I have Devyn back on. I had so much fun with her interviewing me on more of a personal business front. We decided come back on the podcast and ask me everything you want to know about pelvic floor. And really what are some hot questions that we get from clients and interested people that they want to know more, right? So we are diving in today to talk all about pelvic floor physical therapy, pelvic floor health, women's health in general. So Devyn, take it away. And also, if you didn't hear the last episode, go back and listen because Devyn killed it. She asked me some absolute amazing questions. Devyn is the GM here at Body Motion, managing both locations, managing the wellness business online. And so welcome, Devyn.
Oh, thanks. It's such a beautiful office.
You just can't see the other side of the beauty. Mm-hmm. The stacks of paper, the luggage, all the weird stuff, yeah.
I thought it would be fun if we started with a myth-busting game. So I'm going to ask you some questions and you tell me if it's fact or fake.
Ooh, yes. Go.
Okay. So leaking at any time in your life is normal.
False.
Well, I know the answer, but they may not. That's an attitude.
Leaking is never, ever normal. Okay? Yeah. If you are leaking, your pelvic floor is not working for you, something is going on in your body, and that is not normal. It's very, very common. Women are just expected, that we leak. So it's very, status quo. People just assume that it's normal to leak. And it's also, a little bit taboo, although I think it's less and less taboo, and people are just oh no, I peed my pants a little bit, and they're putting it on social media, Mm-hmm. So absolutely not normal, and there's a lot you can do to fix it, and you should fix it so that your core is optimally working for you, because if you are leaking, that means your core is not working for you, and that means you're going to wear out your joints. So
yeah.
Take it away.
I love it. I was expecting her to say false and then just move on, but love that you gave an explanation. Diastasis recti has to have surgery to heal.
Absolutely no. Completely false. Yeah, so diastasis is very common, and usually I the most up-to-date research says that most people have diastasis recti by 38 weeks pregnant. You want to do what you can to minimize the effect of it being clinically significant for you and from it not healing. And so working with a pelvic expert physical therapist is really important. And even if you decide that your diastasis is the size of a football, and you need to get surgery, you should always do pelvic floor work beforehand in order to maximize the results of that surgery. So some people do end up getting surgery, and there's, it's not right or wrong, but ideally you can, most people can heal their diastasis without surgery.
So vaginas are self-cleaning. True or false?
True. You do not need soaps, you don't need sanitizers, you don't need all the, I want to say they're sold as coochie cleaners. You just don't need that shit. That's what they're called, right?
Yeah.
Or whatever. Well, yeah, don't buy into that marketing. Vaginas clean themselves, vulvas clean themselves. Don't use soap. Use water. Use water for your vagina. You don't need soap. It's not good for it. The pH normalizes itself. If you're worried about the way you smell, all vaginas smell a little, there's always a scent there. It's not that it's, if it's a strong odor, talk to your doctor about it. Mm-hmm. Some people do have low-grade yeast infections. Some people do have a, bacterial vaginosis. Some people have, other conditions, but it doesn't mean that that's super scary. You should just talk to your doctor. So if you do feel a bad odor is coming from your vagina, then or a strong odor, then talk to your doctor. But small amounts of discharge are normal, especially different times of the month, when you're ovulating, and so that's not a red flag either. In case you wanted
heard it here first.
Yeah.
No coochie cleaners. All right. So then my last one would just be pain with intimacy is normal. And that you need lube and that kind of thing.
Yeah, I mean, when hormones are balanced, you don't need lubricants. You would hope that your muscles are healthy enough that you can have self-lubrication is plenty, but some people do need lube, and that's okay. We recommend a water-based lubricant. That tends to be the best and least irritating for the vulva and the vagina. And there also are silicone lubricants that can work for certain people as well. I highly recommend, so that's the lubricant side of things. I do not agree with your fact of intimacy should be painful or needs, no one should ever have pain with intimacy. Sexual intercourse should actually feel good for both parties. If it doesn't feel good for your body, then that's not great. And I do suggest, get help if it doesn't feel good, because the more that you go into situations where your body isn't happy or you're not feeling good, your brain remembers that, and it kind of becomes this pattern inside the brain that is like a negative connotation, like, oh, every time I have sex it's painful, it's painful, it's painful. You're conditioning your brain to feel that pain, and then a lot of times you're conditioning your body to guard against that pain, which is then going to honestly make things even worse and make it more painful. And so it's not a great cycle. So if you are having pain with intercourse, this is something that, work with a pelvic expert physical therapist, get some help. The common pain complaints are people will feel burning upon initial penetration, and or a lot of tightness regardless of how much lubricant they use, or that their partner just can't get in. And then a lot of people will feel like if they are they'll feel like they get pain with deep thrusting positions, or that deep thrusting is just kind of off limits, and they don't want their partners to go fast or hard, or certain positions make it feel like they're hitting something, maybe their partner's hitting something. These are all signs that your pelvic floor is really tight and constricted and doesn't have a lot of range of motion. And so sometimes it's such a simple fix, and I say simple because this is what I do every day, but I know it can be all encompassing, but pelvic floor physical therapists can teach you how to open up and relax these muscles so that it actually feels good for you having intercourse. You shouldn't feel like your partner's hitting something. Most people think that their partners are hitting their cervix when they're doing the deep thrusting, or when certain positions feel like they're hitting something, and it's not your cervix that is feeling that. It's usually the third layer of the pelvic floor, sometimes the obturator internus of the pelvic floor. With initial penetration pain, a lot of times it's the first and second layer of the pelvic floor. So the pelvic floor has multiple layers and different structures like fascia and muscles. And when those become tight and constricted, they can create pain during intimacy, during intercourse. Also, it's very normal, just so people know, for women to have clitoral orgasms. And when people are like, oh, I don't climax with sex, or I don't get a good G-spot orgasm. And that's essentially just your clitoris. It's just on the inside of your clitoris. So a lot of people are concerned about that. And the clitoris is a muscle, and you can train your muscle to have an orgasm, and you can train it to have an orgasm by stimulating the clitoris externally or stimulating the clitoris internally. Nothing is right or wrong. Most people don't actually have those internal orgasms. They tend to have more external orgasms from external stimulation. But if you're not able to achieve an orgasm, or you have to work really hard to achieve an orgasm, or that orgasm is painful, then that would be a time, again, that you should, all of those are a little bit of red flags. That's not normal, very common, but not normal. And you could work with a pelvic expert physical therapist to truly work through that. Sex should feel good.
So you talked a lot about the pelvic floor, needing a pelvic floor physical therapist, an expert in the field. And so 10 seconds, what is the pelvic floor? What is its main function? Why does it matter?
10 seconds. The pelvic floor is the bottom of your core. It is responsible for your bowel movements. It is responsible for peeing. It is responsible for delivering babies, and for sexual intercourse, and for pleasure. So those are the primary functions. Did I say urination? It's also responsible for urination. And it's a deep core muscle that, if it's not working, then you're going to have a weak core, which is going to put more stress on the rest of your body.
So you're telling me that the pelvic floor is responsible for 5 major functions, as well as supporting our entire body. And we're pretty much told that Kegels is the answer to everything.
Yeah,
of course.
But that's a fact. That's a fact. That's a false statement. Obviously, Kegels are one form of movement that the pelvic floor does, and they might have a place, but don't have a place most of the time.
Yeah.
Most women have really tight and constricted pelvic floors. Now, tight and constricted pelvic floors are weak pelvic floors for sure. When a muscle is tight, it's weak because it's not operating in the full range of motion. But all simply you have to do, and I say simply, but usually it takes working with someone who's skilled in pelvic floor therapy, is you have to train your pelvic floor to open and elongate. And once you train it to elongate, you naturally will get contractions throughout your life, whether you're doing squats, whether you're doing hip exercises, deadlifts, doing CrossFit, going for a run, going for a walk even, you're going to get a natural recoil of the pelvic floor. What matters is that it's dynamic and can elongate, and then you'll naturally always get that shock absorption, you'll get that contraction, so you don't need to really go bust out 100 Kegels.
Yeah, and I think that's something that, since working here and like talking to clients and new patients, it's really like apparent that that's so instilled in our society. It's like, do Kegels, you want to be really tight, it's going to make sex better,
Yeah.
like all the things, when really like a lot of our clients who are struggling, it's because they've been doing it. And I love what you always say. It's like, if Kegels worked, our moms wouldn't be peeing their pants.
Yeah.
You know? And so it's just, you know, food for thought.
Yeah. No, that's great. And also just like to comment on that, people want to be really tight for their partners or because they think it's going to make sex better for everybody. And the reality is, like, what makes sex better is when you have a really healthy muscle. So when your pelvic floor is strong and healthy and has really good range of motion, it has really good blood flow. And when it has really good blood flow, it is a beefy, healthy muscle. When that muscle is dehydrated and tight and doesn't move much, it is going to be that texture of beef jerky. I know you're going to roll your eyes.
I've heard this a million times.
I say it every time, but it's the truth. Like, and that doesn't feel good for sex. You want the beefy, healthy muscle, because a muscle that has range of motion and that has that beef is going to be 10 times better to have sex with. So keep it. Don't cut that part.
I know.
It's the truth. It's the truth.
Okay, what's the cringiest thing you've seen online about pelvic health?
Cringiest thing.
Yeah, that you were like, why would anyone tell people that? That's so false. Or
I guess what makes me cringe the most are the Emsella chairs. I'm sure they have their place. Okay? Some people are gonna benefit. But if you think sticking electrodes on your abs is gonna give you six-pack abs, you have another thing coming. If we think that sticking electrodes on the pelvic floor to create a contraction is gonna help, that's not gonna create a contraction. That can increase the neuro connection to the muscle, like the nerve conduction to the muscle, so you might have better recruitment of the pelvic floor. But again, if you have elongation, that happens naturally, so you don't actually need to, like, yes, you need some recruitment, but it's not necessarily usually what you need to train. If you train the elongation, automatically you get the pickup. Now, you might not, and then there's treatment plans for that. But what the Emsella chair is, and I hate to call out a brand, but I guess I'm doing it because this is the truth. This is how I feel. And when a client tells me that they've had this chair, it honestly gives me the fucking heebie-jeebies. Because what happens is you sit on this chair, it stimulates not just your pelvic floor. This stimulates your adductors, your glutes, your hamstrings, right? And so every muscle. And now, I haven't personally done this, but that's what I've read and that's what I've heard. And so I'm getting that from secondhand information. I should go sit on one myself and I could speak better to the cringe. But like, that makes me, as a pelvic floor PT, like, that makes me a little irritated, because most of the time our pelvic floor clients, or if you have a weak pelvic floor or your pelvic floor isn't working for you, or you're leaking or you want better sex, like, tightening your glutes, your hamstrings, your adductors, and like holding that contraction and getting whatever they sell you, 20,000 Kegels in, however many minutes it takes, like, you don't want that. Because it's just creating neurologic overflow to muscles that already have neurologic overflow, which is already creating that like tension pattern. We need to dysregulate that tension pattern, and then you'll have a healthy pelvic floor. So I guess that's what makes me cringe the most, because like, and whoever the fuck invented this is like, you can't actually think that this is the answer, that this is helping people, but maybe they do. And I'm sure they have positive testimonials, like they must, right? Else people wouldn't do it. But, I mean, time and time again, we see like people like develop pain syndrome, so all of a sudden they would they did it for their leaking, but now they have painful intercourse, or they did it for, you know, something else, and now they have constipation, or they have hemorrhoids now, right? Because it's just the tension was just so great. So they got stuck in a chronic Kegel. They were already stuck in the chronic Kegel. They didn't need to sit on the Emsella chair in the first place. So cancel me.
Period. And we're gonna end there.
All right, like and subscribe, share this with your friends. Let us know what else you want to hear, because this was a fun episode. So drop us questions, throw us DMs on YouTube or on our Instagram. All right, take care.